Hello, everyone. I want to welcome you to our monthly weight loss surgery in Mexico informational webinar. I'm waiting just a few more moments, so make sure everybody joins and we can get started. Again, this is Mexico Bariatric Center informational webinar. Today, I am hosting this webinar from our Sacramento office. My name is Ron Eli. I'm the CEO and founder of Mexico Bariatric Center, MBC. And I have the pleasure of having Dr. Miguel Montalvo from our Tijuana surgical team joining us. I appreciate you taking time to join us for this webinar. As you all know, we do a raffle at the end of the presentation for a $2,000 off of surgery package. So if you have not filled out a health questionnaire prior to this webinar, go ahead and do so by going to mexicoBariatricCenter.com//health-questionnaire/ and select Dr. Miguel Montalvo as a surgeon of your choice and watch the webinar to the end. It's important for you to stick around until to the end of the presentation until we do the raffle. People who have filled out a HQ before, whether you selected Dr. Miguel Montalvo or not, you're still in our system, so we don't have to resubmit the HQ. We just switch you. Of course, this raffle is only for Dr. Miguel Montalvo and the procedures that he offers. So if you have signed up with a different surgeon, we need to switch you as long as he will approve your HQ. So everyone, as you know, you can ask questions on the Q&A tab, and we try to answer all your questions, as many as we can, and toward the end of the presentation. If you need to make a payment, it will be MexicoBariatricCenter.com/make a payment. And also our vitamins, you can find them on emergebariatrics.com. We try to answer as many questions as we feel is commonly asked. But again, please make sure you pay attention so we don't have to repeat those answers. And at the end, we will answer the ones that we haven't covered. The topics that we are going to go over today is what is obesity, the risks of being obese and overweight, weight loss surgery. We talk about MBC, Mexico Bariatric Center, and what is it that we offer. And Dr. Montalvo is going to go over all the bariatric surgery options that we offer, including laparoscopic and endoscopic. And we talk about importance of bariatric vitamins after procedure and emerge, how emerge is different. And we will have our Q&A, which is question and answer session at the end. And once we're done, we do the raffle for the $2,000 off. By definition, we all are categorized based on our height and weight, which is basically put in a formula that gives you a number, which we call body mass index, BMI, as you heard it. So BMI of under 25 is considered healthy, normal. Once you start going over 25, then you're in the overweight. And then once you over 30, obese, and it goes up to morbidly obese and super morbidly obese and super morbidly obese. One thing about our center, as you're going to see in our presentation, that we offer a wide range of procedures and the capability of our surgeons to handle BMI of even over 100 in our center. So obesity is really a chronic disease and is growing in US as well as the rest of the world. COVID was a wake-up call for us to start losing weight and live a healthy life. The problem is high calorie, fast food and processed food and sugary drinks, ultra processed food, and the way of life, which is we are just used to getting in our cars and driving from our garage to our work and back, and we absolutely get no activity. So there is no exercise. It's hard to do exercise. You don't have time. And so this on top of our genetics and the environment is causing this epidemic, the obesity epidemic. Of course, like I said, our genetics is a factor, environmental exposure and developmental history. These are all factors in where our weight is. Of course, the stressful life that we're all experiencing, not getting enough sleep, and also the drugs that we take, sometimes they are causing weight gaining. So we all think like, okay, if I put on weight, I basically get more fat cells, but that's not true. Once we gain weight, not only the number of adipose tissues or fat cells increases, it also changes its structure. And structural change of fat cells causing all the problems like diabetes type 2, because you're not sensitive to insulin anymore, and you won't feel full anymore because you're not sensitive to leptin anymore. And of course, you don't respond well to therapies and even vaccination. Obesity is impacting 40% of adults in the US alone. We are, as far as the percentage of obesity, we're not number one, but counting the number of people who have weight problems, we could be top there, or top 10 in the world. Obesity comes with major risk factors. I like to play this video, which simulates what happens when we gain weight, even if in our breathing. So let's watch that real quick.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
Again, like I said, diabetes type 2, heart disease, cardiovascular disease, stroke, lung disease, these are all side effects of gaining weight. Your immune system gets affected. You can get a high chance of blood clots, inflammation. And during COVID-19, we saw that if you're overweight or obese, you have a higher chance of catching this disease, virus, and end up in the hospital, end up in the ICU, and is a higher chance of death because the COVID-19 viruses attach themselves to fat cells, and the more fat cells you have more breeding ground for COVID-19 to attack you. So what are the cure for obesity? Of course, the first thing everybody does or everybody think about is diet and exercise. And when we're talking about diet, is extreme, long-term diet and exercise. We're talking about boot camp type of exercise. It's great to have good diet. It's great to exercise, even with weight loss surgery, but it's not a proven long-term solution for everybody. It's not going to work. Then you have all these, Atkins and all these other programs, Weight Watchers. And then there is diet pills and like keto gummies and recently Ozempic injections, which is actually made for people who have diabetes. People start using it even without prescription. And those are also becoming into picture as a solution. But again, they're not a long-term solution. And the only long-term solution at this moment is weight loss surgery, which is surgical treatment or intervention of obesity. So you lose weight fast and you sustain it long-term. This is what happens, your body's reaction when you go on diet and exercise. So your metabolism decreases, your hunger goes up, and you don't feel full. Your satiety decreases. And easy way of explaining why weight loss surgery is so effective is basically this concept that when you cut the stomach, your hormones changes, and the interaction between your brain and gut hormones changes. So the hormonal change is responsible or is causing the weight loss, the rapid weight loss, and long-term. So example of this person in my right side, which is shown in red with the 250 pounds, the brain, what we call metabolic system or brain thermostat, is set at that weight of 250. If this individual goes on extreme diet and exercise, and let's say they are successful to lose 75 pounds, their body's reaction is like we showed in the previous slide. Their hunger goes up and metabolism goes down. So it's resisting this weight loss. But when you get bariatric surgery, the minute you wake up because of the hormonal changes, your body's reaction is your brain is going to see you at 175 pounds now. And what it does is going to make your metabolic system or metabolism higher, and your hunger goes lower. And that's the difference between bariatric surgery and diet and exercise. So bariatric surgery resets our metabolic thermostat or our metabolic system. So if you are uninsured, underinsured, or you can't afford the surgery where you are, medical tourism is a choice. And Mexico is offering one of the top destinations for bariatric surgery, especially Tijuana. Tijuana is becoming the center for bariatric surgery. So when you start looking to medical tourism, you have to think about two things. One is the logistics, which is transportation and coordination and hotel accommodation. And the second one is medical care. So you have to make sure you go with a facilitator or coordinating company to make sure your transportation, hotel accommodation, and coordination is set so you don't have to worry. And it takes all the unknown factors out of the equation and give you peace of mind so you can focus on your surgery and the medical care part. And also you have to make sure the company you go with has a history, has proven results of doing this for years. And they're not just a fly-by company and they just put some before after pictures that could be manufactured. You can actually, do this, buy these before after pictures, or put them on Instagram, and you think like this company has that expertise. So in order to travel safe to Mexico and make sure your surgery goes well, you need to look to these factors. MBC offers quality medical care with VIP treatment. We talked about the power of social media, how social media can affect certain procedures or services to go up or down. And again, make sure the credentials of the company you go with is there, and you can see it online, you can see the reviews, you can see their before after. MBC is a US-based corporation in our office in Sacramento, like I mentioned. And our mission since inception has been to provide high quality weight loss procedure in Mexico with most affordable prices. These are all the factors that come into picture when you say, why choose MBC? Our reputation, our reviews out there. We match the patient with the best surgeon for the right procedure. That's huge, to be able to get the right procedure. I always say that if you get plastic surgery and if it's not done right, you can see it and it's visible. But if your intestine or your stomach is changed and is not a proper procedure for you, you'll be hurting for the rest of your life. The packages that we offer are all inclusive. Safety is our number one priority. We have surgeons that are double board certified. You get care before and after surgery. There's a lifelong support that you have after surgery. Our results are proven. We have done over 20,000 procedures, successful procedures, over 10, 11 years that we've been in business. Our scheduling is pretty straightforward, like 1, 2, 3. We do informational webinars, seminars for post-op, pre-op diet, for our informational webinar monthly. Our complication rate is extremely low. Again, we are a US corporation with the A+ rated Better Business Bureau. We are certified by Medical Tourism Association. We help you do the FMLA, return to work forms. Our nutritionist is on staff and help you with the diet. We do have US surgeon liaison that reviews all the HQs with the surgeons. Another piece that we offer is medical tourism complication coverage. Of course, that's optional, but we highly recommend that. In our commitment to provide high quality services, we've been working on this center, which we call Azar Surgical Center, and this would be live hopefully in 6 weeks, and we will be enjoying our new center. And this is a video of some of the construction. These are some of the pictures. Of course, we're still in the construction, but this is what the room's gonna look like. This is about 2 years ago when we started. That's Dr. Valenzuela with me. I mentioned we've been in this medical tourism over 10 years, 20,000 bariatric surgeries with top 7 surgeons in Mexico. Our packages, this is our gastric sleeve or endo sleeve, gastric bypass or DS, and gastric balloon packages, what it includes, which is hotel, hospital, pre-op, post-op tests, medications, hospital fees, nutrition support, private transportation, and medical tourism, discounted medical tourism option. Coverage, insurance coverage. Again, our MBC process is simple. You do the health questionnaire, you select the surgeon. Once you get your approval, you pay the deposit, and you're on your way by booking, arranging for your flight or driving to San Diego International Airport, and we complete your files and you're good to go. You do your pre-op and you are on your way. The support is huge, pre-op as well as post-op, and we do provide that with different groups we have. We have a support group, over 10,000 patients, and we have another group which called Insight. Those are for people who are thinking about doing the surgery. They're on the fence. So we offer all this support before and after. We have 6 of our past patients on our staff that they are affiliates. They feel the same fears, the same, challenges that you are facing, and they're there to help you. Kelly Sarita has been with us so long, so many years. Rena, Dawn, and Judy. They do have a podcast. I recommend you watch those. They're very informative. When you fly or drive to San Diego International Airport, our drivers are there to pick you up. We want you to be there before 12 p.m. and depart on the day of your departure after 2 p.m. This is the network of our surgical teams in Mexico. Dr. Miguel Montalvo, which we have a pleasure to have him here with us, Dr. Luisiana Valenzuela, Dr. Alejandro Gutierrez, Rodriguez Lopez, and Jacqueline Osuna. Jacqueline Osuna is working in Tijuana as well as Guadalajara, and Dr. Jesus Ceja. I was talking about matching the right procedure and the right surgeon to the patient. You see our surgeon liaison sitting in there alongside a patient coordinator and nutritionist to select which patient matches the best with which of our doctors for the procedure that they're looking for. Our pre-op diet is based on BMI. So if your BMI is lower, closer to 30, you only require to do a 2-day clear liquid. And it goes up from there to 1 week and several weeks. The idea of pre-op diet is to shrink your liver and lose weight as much as you can for the surgeon to be able to get in laparoscopically in the stomach cavity. And the better job you do, the easier the surgery is on you and the surgeon, and an easier recovery. Also, like things like stop smoking. These are all huge factors for you to be able to go through the surgery easier and come out easier. So we recommend that you do this. It's not very difficult. It just needs commitment. We use at this point Hyatt Place, and some of our patients go to Fairfield Marriott. When you arrive, we do all the pre-op tests, you relax and be ready for the surgery in the hotel, and then we pick you up the next day. Of course, the hotel provides Jello, broth, and ice chips, and your companion gets free breakfast. On the day of the surgery, you show up in the lobby and we take you to the hospital to get your procedure done. We keep you 1, 2, or 3 nights in the hospital, depends on the procedure you go through. We do our multiple leak tests, and you be on your way to get released from the hospital and go home. I mentioned one of the reasons we said why MBC, and it was the complication rate. Our complication rate is well below 1%. And one of the reasons is our surgeons' load management. We don't load our surgeons heavily every day. We cap their surgeries based on their complexity, and they never get tired, so they're always fresh to do the surgery. At this point, I'm going to let Dr. Montalvo to get with explaining all the surgery options that we offer as a whole, and then I will take over after he's done. Dr. Montalvo, thank you so much again for your time, and I'll let you take over.
Hi, good morning to everyone. Thanks, Ron. All right, well, we're going to talk about all the procedures. The procedures that we offer, the gastric banding or lap band, is the less that the less we use right now is, but the more frequently is the gastric sleeve at this time, and other procedures with more complex are the bypass, the duodenal switch, or the SATIS. This is single anastomosis duodenal switch. Various laparoscopic gastric revision surgeries. If you have a previous lap band and you want a revision of that procedure, we can make some surgeries from lap band to gastric sleeve, lap band for or to RNY or mini bypass. You have a previous gastric balloon, we can make some procedure, a revision procedure to convert to a gastric sleeve or a bypass. And we have the endoscopic therapy, like the gastric balloon, the endoscopic sleeve gastrectomy, and endoscopic bypass revisions. Okay, the weight loss management spectrum, as you see here in this picture, if you make some kind of exercise, diet, medication, pharmacotherapy, we are at one time that you can lose more weight. because you stuck and you need something else. How can we help you with this? We can make some endoscopic procedure or the bariatric procedure, the bariatric surgery, like the gastric sleeve. The gastric sleeve is the most common procedure doing in the worldwide, or can be the RNY or revisions. Obviously, after a gastric procedure or a bariatric procedure, it's very important to the patient to continue doing some kind of exercise or activity and keep under nutritional uh, observation or follow up, nutritional follow up. Okay, this is part of my team, the anesthesiologist and the assistants and the nurse. Uh, this is some of my curriculum. Make a lot of receive medical training from faculty of BC State here at the State University. More than 2,000 bariatric procedures, and I'm certified by the Mexican Council General of Surgery and fellow of the American College of Surgeons. Talking about the gastric sleeve is the most common procedure in the worldwide. Here we remove approximately like the 80 or 85% of the stomach using from 1 to 5 tiny incisions. This is like 5 millimeters. It's very tiny, and only one of 10 millimeters, there's where we take out the stomach we're going to remove it. This procedure utilize restriction. It's a restricted procedure. What is this means that we're going to remove the gut hormones that cause hunger and satiety, and obviously it's a restricted procedure. You're going to feel fuller up when you take some liquids. The absorption is not affecting this procedure, so the expectations is high amount of the excess weight loss. Remove the portion of the stomach with the ghrelin hormone. This is the hunger hormone. When in the part of the fundus of the stomach that we remove, there goes that hormone, so you're not going to have more hungry. Hold less food and decrease the food intake, and it's a minimal invasive laparoscopic procedure. The pros can be easily reduced if you need it. What this means that you have a previous gastric procedure like the sleeve, and I don't know, you want to continue losing weight or it's difficult, it's more easy to make this revision for another procedure like a bypass or a SATI. It's comparable weight loss to the gastric bypass. Both of them have similar weight loss percent, all right? The difference is like 1%. And it's no changes to anatomy and less malabsorption. This means that because it's a restricted procedure, then you're going to absorb all the nutrients. Obviously, you're going to eat less portions. That's how you're going to lose weight. And the short recovery time. The cons can be worsened the persistent acid reflux or GERD. So we do not recommend if you have a bad acid reflux or a severe gastric reflux or GERD, this is not the right procedure for you. You will need another procedure like the RNY, like a bypass, and it's not reversible. The duration is approximately like 1 hour. You will need 2 nights at hospital, and the recovery is 1 to 3 weeks. All right. This is a restricted procedure, so you're going to eat less portions. All right. You're going to eat only the food that you need, no more, because you're going to feel full. So you need to be or to take only the calories that you will need. So that's very important to have a nutrition control. You will have more satiety due to the leptin hormones or the fat cell, and the gastric emptying is less time to absorb. The single incision gastric sleeve surgery. This operation is performed through only one opening of 1.5 inches wide in the umbilical or navel area, hiding inside the belly button, so the abdomen looks scar-free and any drain tubes are removed. The expectations, the pros and the cons are like the same, like I already mentioned, only that here you're going to have only one incision, and maybe it will depend of how do you heal. Maybe it's not going to people's not going to notice. The duration is approximately like 1.5 hours, and the hospital you will need 2 nights, and the recovery to 1 to 3 weeks. The endoscopic gastric sleeve surgery. This is performed by endoscopic bias. All right, so the surgeon or the endoscopic is going to put a tube inside your mouth, and they're going to put some stitches inside your stomach. So it's going to perform by folding the stomach to create like a banana-shaped tube. And this procedure puts a little restriction to limit how much the patient can eat at a time. The expectations is the similar in the previous, that hold less food, lower amount of excess weight loss, and not well suited from patients with gastrointestinal bleeding, a large hiatal hernia, or previous abdominal surgery. Is reversible, this procedure. So reduce complication rates, no incision, removing tissue, and shorter recovery time. The cons is potential risk of partial opening of the stomach pouch, because we're going to put some inside of the stomach, some stitches, so we can open, and it's potential risk of ulcers. The duration is approximately like 30 minutes, 1 night at the hospital, and the recovery is 1 to 3 weeks. The Roux gastric bypass surgery was one of the first bariatric procedures, and it's like the father of all the bariatric surgeries. So like this is the oldest one, is the most people most know about this. And the gastric bypass surgery forms a new stomach pouch while the remaining stomach stays in place. We're going to make a pouch like it will be like the 10% of your stomach. Okay, as you see in this picture, we only make a small pouch, and we will need to make a connection with the small intestine to reroute to bypass food digestions, which creates malabsorption and reduce the calorie intake. So the expectations is more significant excess weight loss than sleep. Here, you're not going to absorb all the nutrients. This is the difference with the sleep, all right? With the sleep, you're going to eat less, but you're going to absorb all the nutrients. Here with the RNY, you're not going to absorb all the nutrients. The new stomach performed to reduce the hunger and limit stomach capacity. Like the other procedures, they resolve diabetes type 2, hypertension, arthritis, cholesterol. This type of procedure is a better choice for patients who had bad reflux or GERD patients, severe GERD patients. The GERD or the reflux have a lot of factors. The overweight, one of the most common is a hiatal hernia. So it's important if you have a hiatal hernia, because we will need to repair it. The pros is known as the gold standard of bariatric, because it was the first gastric procedure for obesity. Improved obesity-related comorbidity like diabetes, high blood pressure, high sleep apnea, PCOS, and high success rate. The cons is change of vomit and dumping syndrome, and high risk of ulcers. The duration is approximately to 2 hours and a half. You will need 3 nights at the hospital, and the recovery is from 2 to 4 weeks of recovery. What's the best surgery for me? It's very important to put all the informations on the HQs, okay? So we can check it and decide or recommend you the best procedure. So the if you have you don't have a previous gastric procedure or bariatric procedure, is going to be your first. Your you don't have medical issues. The best, and your BMI is not too high. We recommend most of the times to start with the sleep. Okay, if you have a previous gastric procedure, high BMI, you have severe acid reflux or GERD, so slower metabolism, some medical issues, some of the surgeons will recommend you to make a gastric bypass. This will depend of your HQ. So that's very important to put all the information there. The mini gastric bypass, or is called the one anastomosis bypass, is almost like the same of the R&Y. Only here we only do one connection. Okay, in the R&Y we will need to make two connections. Here in the mini gastric bypass, we're going to make one connection on the gastric pouch and the small bowel or the small intestine. The weight loss on both of them is the same. It's the same. Okay, only how we can decide of which one we will do. It will depend of the HQ and your medical issues. The mini gastric bypass divides the upper portion of the stomach to a tube-like pouch, which hold only 4 to 6 ounces of food. The intestine is looped to connect with the new stomach to decrease the amount of calories you absorb. The expectation is reduce the feeling of hunger through the altered gut, early satiety, or feeling full after small portions. Reduce calories and nutrients absorbed. This is through a malabsorptive procedure so the calories and the nutrients is not going to be well absorbed. And like the other procedures, the gastric sleeve, the R&Y, the one anastomosis, the endoscopic procedures will resolve the type 2 diabetes, hypertension, cholesterol, arthritis, PCOS. The pros is only a single anastomosis or connections from the gastric pouch to the small intestine. It's safe, it's effective, and shorter procedure than standard R&Y bypass. One of the most effective surgeries to reverse failed gastric sleeve and lap bed. And the cons is a change of vomit, some dumping syndrome, high rate of ulcers, and change of bile reflux. The duration is approximately like 2 hours, and you will need 3 nights at hospital, and the recovery will take from 2 to 4 weeks. Okay, what's the best surgery between the gastric bypass or the mini gastric bypass? This will depend of I already said, the medical issues if you have of the severe reflux or GERD, of hiatal hernia, or a previous surgery. We will discuss this with each one of the patients when you are with us. All right, but the weight loss on both of this will be the same. Okay, next. The duodenal switch surgery. The duodenal switch surgery, also known like a videopancreatic diversion with duodenal switch, is a powerful weight loss and metabolic surgery. This is one of the biggest surgery because we will need to make more connections. You take more time of duration. You take like 3 or 4 hours. The patient loses between 50 to 80% of the excess weight in first years. It's high percent of duodenal switch patients with type 2 diabetes are cured after the surgery, and malnutrition is a problem with duodenal switch after, and vitamins is a must after surgery. The pros is about 80% weight loss in the first years. Stomach is reduced size highest metabolic effect, and highest expected weight loss. As you see here in the picture, it's like like a combination between a gastric sleeve and a bypass. Because if you see the picture of the stomach, first we need to make a gastric sleeve, then we need to make some cuts and some connections on the small bowel. So this is a like more complex procedure, because this will be a restrictive and malabsorptive procedure. So the counts is extremely strict, vitamins required for life, and higher risk than other bariatric procedures. And the recovery will take 3 to 6 weeks. So at our facility or a hospital, MBC use accredited facilities. Our team use standard infection protocols, screening of patients and staff for CT scan and COVID-19 tests. We have our stations, antibacterial stations available, and fully compliant protective measures, and do not currently visitations. Remember to bring your mask, use the social distancing, test prior your travel, and if the vaccinations. All right, and how can the patients go return to work after bariatric procedure? It will depend of what do you do, or if you have an office work, or you're out doing or lifting, heavy lifting. It will depend. All right. This will go from gastric sleeve or endoscopic procedure to 1 to 2 weeks, and more bigger procedures like the RMY or ascites, duodenal switch. It will take more from 3 to 4 weeks, or it can take to 8 weeks. It will depend of what do you do.
Okay, thank you so much for going over the bariatric surgery options. I'm going to take over here and talk about some of the issues like financing and etc. So we use a couple of companies outside of our company, of course, to get medical loans or personal loans. One is Super Money. Of course, these links are on the emails you receive or on our website. We use e-financing, United Credit, and for Canadians, we use Medicard. Again, you can use personal loan like SoFi, all those lenders, Lending Tree. Just make sure if you're looking to finance your surgery, don't apply for so many people so many places at one time. More than 2, it would affect your credit score. We touched base briefly on medical tourism insurance coverage. We have negotiated with GPS and brought down this medical tourism insurance so affordable. It's about maybe not even 20% or 25% of what they're charging. And we pass the savings to the patients so they can afford to add this. So basically it has coverage for your travel as well as your surgery complications. Again, our complication rate is extremely low, but again, this is a surgery. Things happen, so you may want to look into this coverage. It's very affordable, and it would save you, time and money if you need it. It's better to have it and not use it and then need it and don't have it. That's the thing. We talked about bariatric vitamins. Bariatric vitamins are huge in your recovery. Because your stomach is changing, the amount of food you eating. Of course, you have to start eating healthy after your surgery so your body gets the nutrition it needs, but especially with bypass DS, you need to have long-term bariatric vitamins. With sleep, we recommend at least the first 2 years to go with bariatric vitamins. And bariatric vitamins is not a multivitamin. It's a specific to the needs of patients who go through the procedure. And it has the right combination of nutrients that your body needs. Our product comes with soft chew, chewable, drinkable, and capsule. So, you know, so success after bariatric procedure is not just amount of weight you lose. It's a long-term battle of over 5 years, 10 years. How are you doing? Whether you're you don't want to have nerve damage or bone density problems down the line. So that's why it's important to keep the nutrition up and be active. Okay, so we're getting to the Q&A session, and I'm going to start asking questions. Dr. Montalvo is going to answer the ones that are medical, the ones that are travel related, I would answer. So the first question is, I'm getting surgery soon and I'm a natural redhead. I know sometimes redheads have different needs for anesthesia. Is there anything I need to let anesthesiologists know or surgeon know?
No, you don't have to make any difference. Just with your all the information you put on your HQ. But if you forgot to put something there, it's very important to let us know.
They're asking, is it safe to fly home soon after surgery of this kind? So basically, our packages keep you enough in the hospital. But if you're traveling long distance or you're driving long distance, it would not be a bad idea to stay one more night in Tijuana or in San Diego. In Tijuana, if you needed to stay longer, you can let your coordinator know, so they would arrange for your extra stay in the hotel. Again, on the way home, make sure you wear compression sock, and you make sure that if you're traveling a few hours in the plane, you get up and walk around. If you're in the car, the same thing, stop and walk around. Don't sit for a long time in the same place. So they're asking, what's the percentage of success stories of revision from sleeve to bypass?
I can say that all of them are success stories, because you are we're converting from a restrictive for a malabsorptive procedure, so there's no change that is not a success over there, because you're going to lose weight, obviously with the absorption. You're not going to absorb all the nutrients, so that's the way you're going to to uh, to lose weight. And I think so all of them I can say that it's a success story.
I don't know if we covered the differences between RMY and duodenal switch. Can you explain the differences?
Yes. The RNY is a restrictive. It's only a no, sorry. The RNY is a malabsorptive procedure. All right. And the duodenal switch is a combination of a restrictive and malabsorptive procedure. So the duodenal switch is a more complex, little more complex procedure or surgery than the RNY. So in my personal opinion, I will or we can offer the duodenal switch for patients who have a previous gastric procedure, like a gastric sleeve. And it depends too of medical issues or of the BMI. It's more complex, but the RNY is a malabsorptive procedure. You're not going to absorb all the nutrients, and in the duodenal switch is a malabsorptive and a restrictive procedure because we will need to make like a sleeve and make some connections like in the bypass.
Thank you. This patient is asking that they weigh 195 pounds and they're 5 feet tall. Would I lose too much weight based on my BMI after surgery?
I think it will be like, let me check your BMI. 5 and 195. It's like 38 of BMI. The weight loss, it will depend on you, okay? Like I already said, is it's not going to be like magic, okay? You're going to have a gastric procedure, but after this, you will need to be under nutritional follow and make some kind of exercise. The more weight loss you're going to have is in the first 2 years. After 2 years, you can continue losing weight, but this will depend that you follow a nutrition plan and have any activity or exercise. You can continue losing weight after that, okay? But this will be depend of you.
They're asking about our center. So, this is a construction. There are a lot of pieces that go to a hospital, especially if the hospital is built based on the criteria that is worldwide accepted and is basically accredited center. And we've been working on this since just the construction part about a year and a half now, and it should be ready soon. I would say 6 weeks, but there are so many factors that need to go into opening this facility. So if I say 6 weeks and it doesn't happen, I don't want people to hold me to it. But it should be soon. And we are all anxious about going to a new center. About they asked about our podcast. So I'm going to have to, if you go to MexicoBariatricCenter.com and there is a search here, you search for podcast and it would show you the list of them. Here, I will put this link on the, let me see. So I'm going to type it up. So if you go to that podcast, it has all the podcasts that they've done on YouTube, and you can see the list of it. So, yeah. So this question is for you, Dr. Montalvo. It's asking, if you have small umbilical hernia, can you still get the sleeve with no extra cost? My umbilical hernia is covered for free under Alberta health insurance, and I have surgery scheduled for January 2025. I'm worried you will not perform the sleeve in July if this is not fixed yet.
Okay. Well, these are different things. Okay. In most of the cases, the incisions are up of the belly button, so we don't touch the belly button at any circumstance. The only situations that we can touch or make the incision on the belly button is in the single incision. There's where we put the trackers or the incisions to make the procedure. But no, if you have your already scheduled your surgery on January, no, we're not going to touch it, your umbilical hernia, because the incisions are up of the belly button.
They're saying what kind of supplies you use for gastric sleeve, like staples, sutures, etc.
Yes, all of that, the staples, sutures, the laparoscopic instruments, trackers, the boogie for calibrate the stomach are the most of the things that we use.
Okay. So, do most patients need a revision for the sleeve at some point? Does it lose effectiveness? Does it lose its effectiveness over time?
No, this is a very important questions and more of the frequent questions, because patients think that if they have a gastric sleeve, they will need in the future a revision. This is not true. This will depend that you follow a nutrition plan after the procedure and make some kind of activity. You're not any patient is exempt to have a revision if they follow up this, because even if you have the sleeve, the RNY, the mini bypass, a duodenal switch, or any gastric procedure, if you don't follow these rules, you're not going to lose weight, and you're not exempt to have a revision in the future. So all the patients are in the same, have the same percent of have a revision or not to have a revision. So most of the patients don't have, the revisions are very small percentage that we, of the procedures that we do.
They're saying, are you guys able to do a gastric sleeve surgery for someone that has situs inversus dextrocardia?
Yes, of course. I think it's are very rare cases, but I think all of us we make in some time one of the surgeries.
What's the biggest person you have surgery? So as I mentioned, we have done a BMI of 102. There is a patient that's coming on with 104 BMI. And these are usually 600, 700 pound people.
Mm-hmm.
So there is no limit of what we can do in our center.
Mm-hmm.
They're asking, is vaccine required for this procedure? We don't require vaccination, proof of vaccination. Of course, vaccination is a thing that was, it's with all the boosters, everything's supposed to be helping with the COVID, but we don't require it. And we do recommend you do a test, even if it's at home test before your departure for yourself. And if you bring a companion as well, make sure during your travel, you don't expose anybody. And then once you get down there, you be well to be able to receive the surgery. So about the visitation, after COVID, we stopped keeping companion in the hospital. And of course, everybody knows the reason. There are less touches, less exposure of not only COVID, there are so many other viruses that are going around. I don't know about you guys, but I got a couple of times this year. I got sick so bad with just flu, and I never got COVID, but this was so hard on me. So it's not just COVID. There are so many diseases out there and so many things out there that when you have the companion running around in the hospital, you expose the patients to it, and they're all vulnerable because they're going to surgery. So that has been one of the reasons we were so successful after the pandemic. And we're one of the centers that opened the first in Mexico, and everyone else was few months after us because we had the protocols in place, because of the expertise of our surgical teams, the doctors down there. We were able to do that. So at this point, the companion stays the first night. Of course, they stay with you in the hotel. Once you go to the hospital, they stay in the hotel. They come visit you, but they don't stay overnight. And to be honest with you, I've been looking around in all the centers in Tijuana, and all the high-end places, they're not letting companions stay in the hospital. Only places, not to say anything about our competition, that they let companions stay is a little oversight, I think, at this point. COVID still is around, and it's devastating. So that's the last thing we know. I mean, when we were testing for COVID creates, or it causes scar tissues in the lungs. It really does. We could detect during COVID that when we were doing CT scan, that how the scar tissues from COVID is so different from other scar tissues, and is visible and is detectable. Yeah, so the danger of COVID is not gone. And as we talked about, when we have weight problem and we have all the comorbidities associated with it, like lung disease, diabetes, blood pressure, all these are make us vulnerable for this disease. And I experienced that myself. Like my mother has a lung cancer stage 4, and she was doing better with medication. And this last month she got COVID and totally ruined her, and she is not doing well. So this COVID is serious. So they're asking, how long should you wait for a revision?
In strictly, we recommend to wait 2 years for a gastric procedure revision, because we need to wait that everything inside to heal well, and the scars, we will need to remove some scars, and after 1 year, 18 months is when we can start this is to prevent to have or to do something inside, or to prevent that uh, any can anything can happen that inside. After 18 months, 24 months is secure to have a revision.
They're asking, what's the cost of medical tourism insurance? The cost of medical tourism insurance at this point is $149 with the same coverage. So that's extremely affordable. Another question asking, I'm a 60-year-old woman with a BMI of 28. Would I be qualified for Dr. Montalvo?
Well, to be a candidate for a gastric surgery in the worldwide is BMI of 30. But in some cases, You can send your HQ for maybe endoscopic procedure. Some surgeon can evaluate you, and maybe you can be a candidate. But for a surgery, you will need to be at least at 30.
Are, are you sewing the staple line after you do the staple with the gastric sleeve? Do you sew over it?
We after we staple the stomach, we make some suture. We suture that stomach, and the staples are not visible, are very tiny. This is to make sure that to prevent uh, bleeding complications or leak complications.
Is it hard to stay hydrated if you can only sip water?
No. It's not hard, because uh, it's the only thing that you will need to take the first days. So it's very important to keep hydrated. There is no restrictions with the liquids the first days. So it's important to keep hydrated, because the most patients, if don't take the liquids, then they have tachycardia, they don't feel good. So that's we always to our patients after surgery say that to him to keep well hydrated.
They're asking about the passport. Yes, we highly recommend you have a passport card or passport book. Yes, it's okay. Sometimes people don't get into trouble by bringing the birth certificate and the driver's license, but real ID is different. Real ID, you should have no problem with birth certificate, but the driver's license, normal driver's license, we don't recommend. Again, you run into problems maybe once in a while, and our goal is to get you across with no delay. So China is asking, I'm sensitive to anesthesia. What type of anesthesia that will be used?
It's general anesthesia, and the medications, it depends of the anesthesiologist, but most of them, no, it's just that in they use on the worldwide, but like I don't want to mention in one in specific, but it's general anesthesia, and then the anesthesiologist will talk to you, and if you are sensitive for one of them, they will not use it.
I've been asked for cardio clearance. What factors does this address?
Uh, this will depend of what kind of medical issue you have. Some patients have heart failure, have some stents, previous heart attacks. That's when we most require the cardio clearance, but it will depend of what information do you put on your HQ.
How quickly do you start seeing weight loss after procedure? Does it depend on different factors to how quickly you start seeing results?
This will start if you make a good pre-op diet. uh, it's when this will start. This is important of the pre-op diet, because with this, you're going to start losing weight, and this will prepare your body for the surgery. And this will be a very good point for after surgery, because this means that you will be a very good patient, because you're going to follow the rules, you're going to follow a nutrition plan, you're going to make some exercise, and the surgery will be a very good point for you.
Do you still recommend a gastric sleeve for someone with NERD, How about CSEG caused by high amounts of Helicobacter pylori?
Okay. The patients with GERD, it depends the what kind of GERD or what are the factor of the GERD you have, because GERD have a lot of factors. Is the hiatal hernia? The hiatal hernia is one of the most common factors, but we have other factors like the overweight, like the diet, and when you don't have any of these ones, best procedure will be the RNY. But if you have occasional GERD, or you don't take medications or pills, sometimes it will, with the weight loss, will be better, will disappear. Or when we go in and see the hiatal hernia, we will repair the hiatal hernia, and the GERD will go away.
Okay, so are blood thinners given after surgery to reduce the risk of blood clots?
Yes, of course. After we finish the surgery, we put immediately the blood thinners. This is a universal measure after a surgery.
I had an RNY gastric bypass years ago. Am I able to get gastric sleeve, or would be a revision best?
Okay. No, the RNY is not reversible. And you can have a revision. You can have a revision, fill up your HQ, and we have some options for patients with RNY, some endoscopic procedures or revision surgeries.
So they're asking if I have an IV vitamin treatment post sleep, do I need to take bariatric vitamins? Is there a specific IV recipe for post-bariatric surgery?
It will depend of what procedure do you have. If you have a sleep, there is not restriction or malabsorptive, or do you absorb all the nutrients and all the vitamins. And this is more important in patients with RNY or SADIS, and will depend of the results of your blood test. And if you already have the IV treatment, you don't need to take right now the pills. Maybe you in the future, maybe next month or in a couple of months, you will need it.
If I have a BMI of 74, how much weight will I lose in order to have BLA surgery? You know, they're asking, that's the pre-op diet is not for you to lose weight to qualify. Pre-op diet is to make room and shrink your liver, no matter what your BMI is. So there is no requirement to lose weight. It's a requirement to do the pre-op diet precisely the way we say it. So they're asking if I have GERD reflux, would RNY be a better option for me?
Well, strictly talking is yes. But if you have, if you can have a previous endoscopy and send it to us, or just know if you have a hiatal hernia, we can perform the gastric sleeve, repair that hernia, and then the GERD will disappear. But if you don't have any factor of that, the RNY will be the best option if your GERD is very severe.
What makes one a better candidate for ESG versus the VSG?
All right. The this will be depend of your BMI, and the other is that the endoscopic is reversible. Uh, it will take only like 12 months or 18 months. And the BSG or the gastric sleeve surgery is a permanent procedure, and it's not reversible, so it's more longer results. After recovery, we will be able to return to normal activity and like biking or normal life. Yes, yes. The only suggestion we make is no lifting for 6 weeks. But you can make your normal activities. Only no lifting.
I've read that I need to stop taking vitamin and supplement 2 weeks prior to surgery. What's the reason for this?
The reason is the bleeding, because this works like in some studies, uh, they have saw that the vitamins can increase the risk of bleeding during surgery. So that's we recommend to stop them uh, days before you come to make your procedure.
They're asking why surgery is so expensive in the US but cheaper in Mexico. So, well, basically, medical tourism is offering these inexpensive packages for several reasons. When we are negotiating with doctors and surgeons, we are looking at volume discount, and we pass that discount to the patient. So if you were to get surgery, if you live in Mexico and you were getting the surgery, it would cost you $10,000 if you didn't use medical tourism. So medical tourism is able to offer these cheap packages, not because we cut corners, because we work with volume and we pass that savings to patients. I had a mastectomy in November of 2021 and implants reduction in 2022. Is it too soon to undergo major surgery?
There's no problems in your HQ. There was a different surgeries in different part of your body, so no, it's no problem. You can come. Send your HQ.
So if a person has ulcers as well as Barrett's esophagus, is that the good type of surgery for them?
Yes, the patient with Barrett syndrome, they will need the RNY, because Barrett syndrome, most of the risk factor was that's a reflux. So with the RNY, most of the cases stop the Barrett syndromes, or go back to sometimes into normal tissue, but you will need to be to be a follow up for an endoscopist after after surgeries, so they can check that Barrett syndrome, because it's a risk factor. It's a risk factor for esophagus cancer or other pathologies like that.
We're getting a lot of good questions, and there are so many of them left. So, what procedure do you recommend for a BMI of 74?
Well, it will depend more of your BMI. If you have any other medical issues, okay? Because and uh, well, it's very difficult just for the the BMI, because sometimes if you came for a RMY or just an example, the dental switch or a bypass, and when we go in your abdominal cavity, then you have a lot of fat tissue, or it's very difficult because your abdominal cavity is not too wide to make the procedure, and sometimes we only can perform the gastric sleeve, and but there are a lot of factors, but the gastric sleeve or the bypass, uh, you can choose both of them. Uh, in this personal case, I will recommend to at least the patients who come with me to start with a gastric sleeve, because only for the BMI is a high risk patient. So we want to not to put it on risk factors for longer surgery. So I prefer to start with a gastric sleeve. The patient will lose a lot of weight, and then maybe in a couple of years, if they want a revision to lose more weight, the surgery will be more easier and the recovery will be more easier for the patient, and the risk factor will going to be less.
So they're asking if you talk to the surgeon prior to the surgery. That's what I always say. Of course, your HQ you submit based on your factors, we determine what's the best option for you. But you still have one more chance when you're down there to speak to the surgeon and make sure that's the right procedure. If at that point is determined, let's say if you signed up for bypass or you sign up for sleeve and bypass is better or sleeve is better, we switch you. It doesn't matter as long as we find out what's the best option for you, we switch you from whatever the best option. How long having giving birth can we do this gastric sleeve? If we're not, so they're asking how much after giving birth you can do the gastric sleeve.
If you're not breastfeeding, you can send your HQ and we can start to schedule you for your procedure. The important here is because we put some medications, IV medications, and you take some pills, and the important here is not to breastfeeding your baby. But if you don't have no problem, you can send your HQ.
So how soon can you schedule for surgery? I said, we have availability because we have so many surgeons, but at the same time, it depends on BMI is a factor, because if you have to have a longer BMI pre-op diet, then you have to wait that long. Okay, so this is another good question. I get so many good questions today. It's funny. So we do recommend that you do a blood test, just a generic blood test, before you come. One thing that shows is your hemoglobin level. This is huge, especially for patients who are coming for revision, especially bypass revision. Bypass patients tend to have lower hemoglobin. And when you get down there, then we run into trouble that we have to add some blood to you, and that's blood transfusion. So here's what we recommend, so you know before you come, so we can take care of it before you come. So this question that they asked was NERD is non-erosive reflux disease. Is NERD the same as GERD?
No, this is well, the difference here is only the erosive thing, but these have the same principle, is the reflux. So the best procedure in these patients will be a bypass, not the sleep, because if you already have a GERD, severe GERD, or reflux, and make a sleep, it can be worse.
So what happens if after or during procedure an emergency happens? So
This will we need first, what kind of emergency? Uh, uh, this time of emergencies are less of 1%, I think, and we will need to act. We will need to make some exams to make what's happening. We have our physician or aftercares in our facility that told us everything. So about that, we will need to act. Sometimes go back to the OR, or only we need some blood tests or oxygen or transfusion. It will depend of what kind of emergency.
are all your doctors FACS certified? Yes. Well, I wouldn't say all of them, but I know Dr. Gutierrez is FACS. Some of our doctors are FACS. So they're asking what makes our facility stand out from others. Well, so success rate depends on so many factors. One of the studies has been done was if a center is doing the same type of procedures every day, they have higher chance of success and they have lower chance of complication. This is documented. So one of the reasons our complication is low and our success is high is the center that we're using is only for bariatrics. They've been doing bariatrics for forever. Same thing with our doctors. Our doctors are dedicated bariatric surgeons. They're not doing like knee surgery one day and bariatric another day and transplant another day. And I don't know, some kind of a GI surgery. So they are doing the same type of procedure. And when we're talking about bariatrics, it's not so limited. Look at all the revision surgeries. Why are we so expert in what we're doing? It's not because we only do sleep. We can do sleep. We could do bypass. We could do bypass in a BMI of 70. We could do a bypass in BMI of 45. There is no limit on the sleeve BMI. There is no, if a patient really does do well with balloon or ESG, which is end of sleep, we do that. So there is no limit on all the revisions from the past open surgeries, from VBG to gastric bypass, band to sleeve, band to bypass, sleeve to bypass, reversal if it's needed of a bypass. We do limited numbers of bypass to DS even. So this is what happens. And you have to look for a center. We have experienced that if a patient has a BMI of 55 and they really need RNY, they may even sign you up for RNY, but when you get down there, they convince you, oh, that's not a good surgery for you. They do sleep because that's all they can do. But we don't play this game. We exactly give you what's the best option for you. And the amount of expertise we offer with these 7 surgeons is that to cover all the bariatric procedures, endoscopic, laparoscopic, revisional. So these factors make the surgery a success with the lowest possible complication rate. That's what you're getting. Okay, so following rules prior and post, pre-op and post-op is huge. Complying with diet shows your commitment, because this is, after all, just a tool. You have to work with your tool. And the commitment is huge. So you need to have that commitment to work with your tool for long-term success. So the cost of BMI is, if your BMI is after 49, it goes up from 395 and up from there, depends on what your BMI is. So usually they are, right now, what, I don't know exact the time of visitation, but the companion visits, I think, from 4 to 6. And we always try to expand that so they spend more time. And, you know, we go from there. Does your A1C need to be a certain level before surgery?
The best is to be under control of your diabetes. This is for the to have a better recovery and healing, because if you're not under control or your A1CR is high, maybe is more risk for have wound infections or have some wound issues, or obviously inside uh, healing your stomach. So the best is to have control on before you come to your surgery.
How long should you wait after renal surgery to get cosmetic surgery?
We recommend to wait 2 years, because the first 2 years is the most weight loss you're going to have. So to have a better results on your plastic surgery, we recommend to wait 2 years. You can start to schedule your surgeries 18 months after you have your procedure.
There is this good one. It says, I'm a truck driver. I bounce around a lot in 18-wheeler. Would I need to take 2 weeks off for sleep after surgery? So for, if they're a truck driver, how long do they need to take off after renal surgery?
Well, if it's a sleep, you can go back to drive, but the important is that not to lifting, uh, to wear your clothes, not too hot inside your uh, your incisions, because it can have some infections or it can open. Just you need to go back. You can do it, but only with those things to not to do.
So, there was another nice one. I was, how long do you need to wait after surgery to be intimate with your partner?
uh, the, some patients, even hours after the surgery, we know, because the nurses told us they so be careful with that at the hospital or at the hotel. Uh, but no, you can do it, no problem. You can do your normal activities after the procedure.
Do you give any medication if we are nervous down there to help us with anxiety?
Yes, yes, of course. We can put something on you, some, we call it some Mexican cocktails. So you can be more calm and to prevent be anxious and relax.
They're asking about gallbladder removal.
Yeah, we can, if you have some gallbladder issues, gallbladder stones, we can remove it during surgery. No problem. If you have an ultrasound before you came, will be better.
Yeah, so we talked about how we manage the HQs that are submitted. So not only our system distributes this based on the criteria, certain criteria, our surgeon liaison sitting in between all these HQs coming in and going to the different surgeons. She's actually American doctor who got her education from Mexico. And she is the one doing all that. She's been with us for over 8 years. So that's another piece of the success is our surgeon liaison. So the financing, if you go with Super Money, they give the money to you. If you go with United Credit, they send the money to us. So you don't have to worry about it. So we take all type of payments. The easiest one is really Zelle at this point. But you can bring a cashier's check, but make sure 2 weeks prior the picture is sent to the coordinator so we know the type of payments you pay. You can bring cash with you, and the credit card has 5% extra charge for every payment that. So we do limited number of cosmetic surgeries. Our cosmetic surgeons are plastic surgeons that are board certified and also experienced in after weight loss surgery patients. So we do those. If you're interested, you go to mexicocosmeticcenter.com and submit an HQ and we go from there. So they said they have water retention in their leg and they have tested my lymph nodes and it didn't have cancer. Would weight loss surgery help with that?
It will help because they need to check what's the factor of that edema or liquid on your leg. But obviously, the weight loss will help with that problem.
Another thing is PCOS. If you want to explain about PCOS, a lot of patients we see, they do really well. Go ahead.
Yes, the PCOS is a problem that you will be with them all your life. This will not disappear, but the weight loss will help a lot to control your PCOS, but it will not disappear.
Okay, so we are getting almost to the end. There are still some more questions, but I think we pretty much covered them all. So I am going at this point to go over the raffle like we promised. And I have all the names in a bowl here. I'm going to mix them all up. And I'm going to pull one name and we'll see who is the winner. Donna Noren. I don't know if I said the name right. So let me see if I can let you talk, Donna. I don't find you, but anyway, if you are not able to talk, please give our office a call today and make sure we sign you up for the $2,000 off a package for your weight loss surgery. I appreciate all you guys joining us, spending your time with us. I thank you, Dr. Montalvo, for taking your time and answering all the questions, and hope to see you guys soon. I appreciate every one of you. Be safe and be happy and healthy. Thank you. Goodbye.